Eastern Cape Premier Oscar Mabuyane has conceded corruption is derailing the provincial government's efforts to combat the coronavirus pandemic. He's warning infections could double this month, collapsing an already crippled health system. Mabuyane will this morning visit several hospitals in Port Elizabeth to monitor infrastructure upgrades, the delivery of medical equipment, the cleaning of hospitals and the recruitment of health workers. Let's cross now live to our colleague Lerato Fekisi. Lerato, what's the Premier saying today?
The Premier has arrived at Norangenza Hospital. I don't know if you remember, Desiree, but we were here 3 weeks ago when the Minister of Health came to do an oversight visit to find out exactly what are the problems at this hospital. And 3 things coming out from that visit. Number 1, not enough oxygen at this hospital, not enough monitors, and also shortage of staff. I remember, Desiree, walking through the casualty ward where Dr. Mapalala, who's heading the casualty unit, said the fertility rate for COVID patients with comorbidities such as diabetes is 100%, and that is because there aren't enough oxygen tanks to cater to these patients. She even said that patients have to wait 24 hours just to get enough oxygen to cater to them. So the Premier is here to see for himself how things are at this hospital. You'll see in shots right now, they're actually inside a COVID ward, and because of safety, we do not go inside there. But when he arrived here, he said now the more critical thing right now is to have all hands on desk. We need to have doctors working, managers managing, CEOs doing their part, doctors doing their part, nurses doing their part to make sure that as the pandemic peaks, as we go towards our peak season right now and numbers climbing so rapidly in the metro, we make sure that everyone that has to function is functioning properly. Earlier on, he visited the maternity ward, which for the past few months was in the media for all the wrong reasons. We saw images of patients lying on the passage, the nurses complaining of shortage of staff in the maternity ward, and we heard right now from the CEO that they're now going to train more gynecologists to work in those wards and super specialists also to work in the maternity ward as well. So good news coming from that ward. And the Premier was pretty much saying that we're not going to talk anymore. We've talked enough, we've walked about enough. Now he wants to see things being implemented. He wants to see doctors operating and working in hospitals. He wants to see nurses working as well. So he was saying to the management that he's not going to come here again and give instructions, but instead when he comes back here again, he wants to see that did the instructions he gave, were they fulfilled. So he's going to do a walkabout at this hospital, at the casualty ward, the maternity ward, and then eventually go to VW for the opening of that field hospital. Another interesting thing which just also highlights the plight of hospitals here is that we are aware that the Deputy Public Protector is actually going to be visiting hospitals in the Eastern Cape and in the metro, and they want to see for themselves that what they are seeing in the media about the poor infrastructure, the poor resources, is it really that way? Because they represent the public, and the public is coming to them and saying, on one side, the Department of Health is saying things are fine, but the public who have to go to the hospitals are saying things are not fine. There aren't enough oxygen tanks, there aren't enough ventilators, the nurses don't come to work, doctors don't come to work. So the Deputy Public Protector is here in the metro. She's going to come for herself and see how bad things are. Above all, find out what the challenges are and then try to come up with solutions. So it's going to be an interesting time in the metro over the next 2 days, because it looks like all political heads now are zooming their attention to the metro to see how can they try and solve the many problems that are facing this metro and the Eastern Cape.
Thank you so much for that update, Lerato. We'll be following to see what happens. Hope to speak to you again in a bit.